Hello and welcome to the For Your Best Self podcast. My name is Brittany Alce.
And Alysa Capawana.
And we are certified physician assistants at dermatology plus plastic surgery. And today we are going to provide a comprehensive acne improvement guide for your best skin. So briefly, I just wanted to touch base on we have treated so many patients with acne, and so we know all of your biggest concerns. We know what keeps you up at night, and we just wanted to give you the best guide so that you can improve your skin with our help and also at home. All right, so what exactly is acne caused by?
So there's a variety of factors that can contribute to acne. And we have four big ones in this. So the first one is your increased sebum production. And so that is basically the production of oils on your skin. And then following up with that, we also have the presence of a bacteria, and it's a specific bacteria that we see in acne patients, and that's C. acnes. With that, we also have inflammation. And when we get the bacteria in the pores, it contributes to that inflammation. So those kind of go hand in hand as well. And then our fourth main contributor is the follicular hyperkeratinization, which is basically when those dead skin cells sit on top of the skin instead of falling off the way that they should. And so they end up leading to comedones because they're clogging those pores.
Absolutely. So acne can manifest in a variety of ways. These include whiteheads, so clogged pores, blackheads, which are open plugged pores, small tender red bumps, pimples, or even large painful bumps, and these are more so cystic. And you can even develop pus-filled bumps underneath the skin. So what are some of the main contributors to worsening acne?
So in addition to those kind of physiological factors, we also have contributors that people can be doing at home and in their own household. And some of those are touching your face, sleeping on dirty pillowcases. Your phone can contribute to acne. Leaving your hair down, especially when your hair is getting oily and producing those oils, and then that's resting on your skin. Certain foods as well, we've found that there are some dairy foods that can contribute to acne. And in some studies, we're seeing that actually skim milk is a big contributor, even more so than whole milk. And then high glycemic foods as well. And these are like your candy, your soda, your chips, and things like that.
Awesome. Even wearing tight-fitting clothing, so my football players, that can cause you to break out as well. In addition to physical and dietary contributors to acne, there can also be hormonal causes. So, for example, you may need additional laboratory workup if you are a female who suffers from conditions like PCOS. Polycystic ovarian syndrome, to be exact, can consist of hirsutism. So this is known as increased hair growth that can show up on your chin and other unwanted areas. Insulin resistance, menstrual irregularities, and very often acne. So that can be a big clue as to whether you may have some underlying hormonal imbalances. So ask your provider if any of these symptoms apply to you, as the next step to treating your concerns may involve a full lab workup.
Absolutely. And what are some of the prescriptions that we use to treat acne?
Yeah, absolutely. So one of the holy grail ingredients that we use to treat acne is retinoids. So retinoids and the compounds contained within their class, such as adapalene, tretinoin, which is very popular, or tazarotene, are going to help clear out the overproduction of skin cells. And they also help to stop the formation of new comedones. It also helps to decrease the formation of inflammatory lesions as well. The oral form of retinoids is called isotretinoin, which you may know as Accutane or Absorbica. This medication works extremely well against acne. However, it requires very close observation with your dermatologist. Isotretinoin can cause birth defects in pregnant women. So patients who are able to get pregnant are required to have a pregnancy test monthly during their office visit.
And we also have some other compounds that we use to treat acne, and that includes antibiotics a lot of the times.
Yeah.
So after we use those topicals, if those just aren't doing the trick, the next step that we can take would be antibiotics. And sometimes that might even be a topical antibiotic. So we have clindamycin, minocycline, and these work by reducing harmful bacteria that contribute to the development of acne, as we talked about before. Sometimes we do progress then to those oral antibiotics. That's usually doxycycline, sarecycline, and these are more specific for the acne forming bacteria. It's especially great for those patients who do high contact sports and they kind of have difficulty adhering to using a bunch of topicals morning, night, whatever it may be.
Gotcha. All right. So, as mentioned above, certain patients may have acne caused by hormonal imbalances. So, spironolactone is an off label prescription that is used or that we use very often to treat acne in hormonally imbalanced women. So, this medication works by inhibiting certain hormones in the body that can cause increased sebum production, which worsens your acne, as we talked about earlier. However, be sure to ask your practitioner if this medication is right for you, as there are certain conditions, such as pregnancy or renal failure, that can serve as contraindications to this medication. Proper initiation of spironolactone will require lab testing to make sure that it's the right fit for you. So, what are some novel ways that we approach acne in the office?
So the fun stuff.
Yeah.
We can actually use Botox for acne. So Botox inhibits the production of sebum, which addresses one of the initial causes that we talked about. And that increased sebum production or that oily skin, it kind of goes along with when you see patients who are coming in to get Botox for excessive sweating as well. So that falls into the same category, and if that helps you understand how that works.
Yeah.
But it's also been shown in some studies to decrease pore size. So it just overall improves the appearance of the skin. So who could say no to that?
Yeah. Not all treatments for acne have to be prescription either. We have some amazing medical grade skincare options in the office that helps maintain a healthy skin barrier and also assist in helping control acne and breakouts. So these can include things like hydrofacials with extractions, and chemical peels, including A peel or VI peel, which is performed here in the office. Both of these treatments help improve tone and texture and provide exfoliation in the skin to improve skin conditions such as acne. A little bit on A peel in particular, this provides controlled exfoliation of damaged skin and includes ingredients like TCA, which assist with the clearing of that follicular hyperkeratinization that we talked about, that contributes to those whiteheads and blackheads. This peel contains lidocaine, making it a very comfortable option for you that can also assist with evening out the complexion of the acne scars that may be left behind.
And there's some other things too that can help with acne, and not everything is always prescription. So in our office, we carry the Obagi Cleansiderm system, which works great for acne prone skin too. There's ingredients like benzoyl peroxide and salicylic acid, and those target that acne causing bacteria, clears dead skin cells. So this system really works amazing to keep acne at bay and support a healthy and clear complexion. Benzoyl peroxide is a great antiseptic, and it helps reduce the quantity of acne-causing bacteria on the skin, while salicylic acid works to dissolve dead skin cells that clog our pores. Obagi also carries an amazing toner that helps balance the skin's pH and prepare the skin for any additional products that you may be using.
Awesome. In addition, we also carry Skin Medica's AHA, BHA cleanser and cream. I personally use these products and I love how they've improved my skin's texture and tone. It's a mild exfoliator that's a great addition to your everyday skincare routine, especially if you have a lot of those whiteheads and blackheads. And remember, a contributing factor to the development of acne includes a buildup of skin cells. So this is a great and effective way to combat that stubborn acne. To note, AHA and BHA can increase your skin's sensitivity to the sun. So be sure to wear your sunscreen.
Of course, always. And finally, we just want to stress the importance of adhering to your skincare regimen as prescribed by your dermatologist. So consistency is the best way to improve your acne. You may not even be able to see results until around the 3-month mark. So I always tell my patients, patience and consistency is key.
Yeah.
Patience and patience.
I tell my patients that acne is a marathon, not a sprint.
Exactly.
Yeah.
That's what gets it done.
All right. So here at Dermatology Plus Plastic Surgery, we tailor your regimen according to your skin's needs, and we are so excited to help you meet your skincare goals. So thank you so much for tuning in with Alyssa and I, and we'd love to book you for a consultation if you are struggling with your skin.
Give us a call.
Awesome. 321-241-1160. Thank you.